November 26, 2019 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Ms. Barnhart. Here. Mrs. Straw. Here. Mrs. Halstead. Here. Ms. Lamar. Here. Mr. Lightfoot. Here. Mr. Mitchell is excused. Ms. Taylor. Here. Mr. Wilt. Here. Chairman Zale.
I am here. Is there anyone signed up for the public forum?
There is not.
Is there anyone present who has not signed to speak who would like to address the committee at this time? Seeing none, I would like to introduce Robert Franklin, Chief Financial Officer of the Monroe County, who is here to present the 2020 proposed Monroe County budget as it pertains to Human Services Committee. We will have a question and answer session period following the presentation. Mr. Franklin.
Thank you, Mr. Chairman. All right, this presentation is a little more than 2 minutes, but we'll try to keep it down to maybe 5 or 6. So thank you, ladies and gentlemen. The 2020 budget presentation as it pertains to the Human Services Committee. Our health and human services spending in the 2020 proposed budget amounts to just over $1.2 billion. Between human services and health services, it comprises roughly 56% of Monroe County's appropriations. Looking at the 4 areas within the purview of this committee, our Department of Human Services, Public Health, our community hospital, and our Veterans Service agencies. Don't be too concerned just yet about the decline in public health appropriations. That department brings forward to the legislative body quite a number of referrals throughout the year. 2020 will be no different, so you'll be amending the budget throughout the year to increase that. Looking at our Department of Human Services, specifically 2 of their larger divisions. First, the Division of Financial Assistance. I believe I made a comment last year, but I think it's equally relevant to say it again this year. The Financial Assistance Division has had remarkable success in moving its temporary assistance recipients from public assistance to self-sufficiency. And I'm going to suggest that contrary to the almost constant misinformation about application denials or sanctions, the Division of Financial Assistance success is wholly derived in what they do for their clients, not what they don't do. Staff within that division are employing behavioral interventions and trauma-informed care practices to improve compliance with eligibility rules. They've designed new employment letters, appointment reminders in plain English, and have updated their programming to better engage clients and encourage their compliance with state and federally mandated eligibility requirements. The division staff has created an eviction prevention work group and advises our community partners on eviction prevention assistance programs available throughout the division's emergency assistance areas. And the division staff have installed new waiting room, audio-visual equipment, new seating, new self-service kiosks at both St. Paul and Westfall Road. And they have a mental health specialist now assigned to St. Paul Street location who can provide on-site mental health assistance and referrals to community providers. I'm not as well versed on the Child and Family Services Division, but I do know it remains a budget priority for Monroe County. Just some very quick highlights. Our proposed budget for Child and Family Services includes full funding for all its staff positions. It includes funding for caseworker recruitment and retention, caseworker development training, senior and supervising caseworker leadership coaching and development training. And it also includes funding for a child and family resource team that can provide caseworkers in the field with on-demand, on-site clinical mental health, alcohol, and substance abuse assessments, And the resource team also provides semi-annual training, which is focused on behavioral health topics related to child welfare. Turning very quickly to our Department of Public Health, and again, I'm not as well-versed on our Department of Public Health as I am Social Services. Again, please don't be too concerned yet about what looks like significantly lower appropriations. The 2019 amended budget includes just over $5.6 million in grants that were accepted by this legislature throughout 2019. That will happen again in 2020. So just some very quick non-grant highlights, because it's been in the topic of the news. Our 2020 proposed budget includes funding for 6 new assistant health services coordinators. That's budgeted within our EI, Special Children's Services Division. Includes $22,000 for 2 additional municipal reps to our Committee on Preschool Special Education. The 15% increase in preschool special ed related services remains in place. And the budget new for 2020 includes $150,000 to help improve EI transportation services and provide a point of contact for family questions or complaints. Looking very briefly at Monroe Community Hospital. Monroe Community Hospital appropriations for 2020 have declined by about $3.6 million, but there's a lot going on behind the scenes in that hospital. There have been a number of upgrades for nursing assistants and nurse managers, plus regular step and contractual increases. Additional funding for temporary help and overtime all have contributed to about roughly a $1.8 million increase in total personnel services. However, that is offset by close to $600,000 in employee benefit cost reductions, mostly due to employee turnover. The hospital's contractual services and supplies and materials budget lines have also been reduced to better align with prior year actuals. And again, the proposed budget for 2020 includes net county support of $2.5 million. I continue to believe and strongly encourage and recommend to this legislature that it continue taxing to support Monroe Community Hospital due to its roughly $32 million accumulated deficit position. The hospital's deficit position has been commented upon in this body, in our local media, and in important credit rating reports. And the hospital's deficit position remains a drag on Monroe County's credit rating. Our Veterans Service Agency, very briefly. Within our Veterans Services Agency, a modest increase in appropriations for an additional half county service officer position is easily absorbed into our $1.3 billion countywide budget. And the Veterans Service Agency continues to provide excellent work through its PFC Dwyer grant program and its contractor, Compeer. Mr. Chairman, that really concludes the presentation for tonight. Happy to address questions at the admin table.
Oh, thank you, Mr. Franklin. Now I open the floor to the members of this committee. I have questions regarding the Human Services portion of this budget. Is there any questions? Legislator Lightfoot.
Thank you, Mr. Chairman. I was slow to raise my hand. I didn't necessarily want to be the first, but I just want to make sure we don't pass the opportunity.
I can change my mind.
No, sir, I have a list of litany of questions. To you, Mr. Chairman, I'll quickly run it down. I don't necessarily see all the staff for the Human Services, but I'm sure they'll introduce themselves shortly. Thank you, Mr. Chairman, to the administration. On page 169, it was stated in the 2019 budget under financial assistance, that one of the major objectives was, and I quote, Monroe County was selected by the New York State Department of Health as a site for the Health Home Case Management Pilot Project. And the goal of this pilot project is to increase enrollment in healthcare management. The project will include on-site, in the acronym NYSDOH, New York State Department of Health, I'm assuming, staff at the St. Paul office to enroll eligible individuals in health home care management, help them navigate through the public benefit process and provide supports for other life issues to produce better health outcomes, end quote. However, through you, Mr. Chairman, to the administration, I do not see this as a major accomplishment in the 2020 budget, page 170. Is there an explanation why?
For clarification, do you mean as a major objective in 2020?
Major accomplishment, sir. So in 2019, it was projected to be a objective, but in 2019, it was not listed as an accomplishment.
Through the chair, Denise Reed, Director of Financial Assistance. When we submit accomplishments, we are limited to the number of things that we can submit, and in the Financial Assistance Division, we've had several accomplishments this year. The Health Home Pilot is up and running. I actually just had a meeting today to review the first quarter, and over 100 people have been seen at the St. Paul office and enrolled in health home management since the pilot started.
Thank you, Mr. Chairman. So that program may not be listed as an accomplishment, but is moving forward. Correct? Through you, Mr. Chairman, to the administration?
Through the chair, that's correct.
Thank you. Again, Mr. Chairman, to the administration on 169, more of what we're talking about. In the 2019 budget, it was stated under Child and Family Services that one of the major objectives was to, and I quote, support, strengthen, and sustain foster homes to best serve placed in the care and custody of Monroe County. Child and Family Services will work to establish a foster parent mentorship program. The program will enlist skilled and experienced foster parents to provide support and guidance to, less experienced, less foster parents. This will promote more stable placement as well as foster homes that will better be prepared to manage youth that might seem more challenging. However, again, Mr. Chairman, through you, Mr. Chairman, to the administration, I did not see this as a major accomplishment in the 2020 budget. Is there an explanation why?
Through the chair, the mentoring program for foster parents was established. We have spent the past year training and developing the mentors and matching them with new foster homes. It has been successful. It's something that we're looking to utilize to a greater degree going forward in 2020, specifically for the purpose of supporting foster parents to take some of our older youth, specifically teenagers. The accomplishments and successes is something that encompasses all of Child and Family Services. So to your question, it not being included wasn't something to signify that it didn't happen or wasn't important, but we had a great number of successes this past year, and the mentorship program was one of them.
Thank you. The reason I ask these questions is because we promote, and then, you know, when we attach dollars and through the budget, we look to see if it was accomplished or not. And when we don't see a report or accomplishment of it, then we have to question it to see if the dollars that we projected or approved were indeed used for these particular objectives. Therefore, through you, Mr. Chairman, to the administration, I again ask a question, as is stated on page 169. In the 2019 budget, it was stated under the Office for the Aging that one of the major objectives was to, and I quote, and I remember this from last year, which I didn't get a familiar answer, I didn't get an answer that I was confident in. And I quote, explore opportunities for an age-friendly Monroe County. According to the World Health Association, also known as the acronym WHO, age-friendly communities enable people of all ages to actively participate in community activities and treat everyone with respect, regardless of their age. And continues on to say that age-friendly communities must make it easier for older residents, for our seniors to stay connected to people that are important to them, help them stay healthy and active, and provides appropriate supports to those who can no longer look after themselves. This is on page 169 in the 2019 budget as a major objective. It continues to say that Monroe County Office of the Aging will seek to secure commitment to a 5-year plan to obtain this age-friendly status for Monroe County. So again, this is 1, 2, now this is the third major objective in 2019, which I think that these are great accomplishments to report on if we have indeed achieved them. But in this particular case, we're looking for a 5-year plan for the aging, that they would be in a situation where community activities treats everyone with respect in Monroe County. And I'd like to know, through you, Mr. Chairman, to the administration, in addition, what has transpired in the commitment to our 5-year plan to obtain age-friendly status for Monroe County?
Through the chair, the Monroe County Office for the Aging, with the support of the county administration, did receive the letter of commitment from the county executive to enter into this 5-year plan. We submitted that along with a proposal to the AARP and World Health Organization, and were notified in February of 2019 that we'd been accepted into the network of age-friendly communities. That was the start-off point to allow us to engage with our Aging Alliance partners, which is made up of organizations from all across Monroe County, including United Way, Rochester Area Community Foundation, Lifespan, and a few others, to start the process. As a result, we engaged in a contract with United Way to hire a consultant. That consultant then did a evaluation of all community plans that are currently published and created a matrix. Of that matrix, they determined which of those plans included the 8 domains of age-friendly living, and we are still engaging in finalizing a plan, developing focus groups, and we'll have more further probably by the end of this year. Through the chair.
Through you, Mr. Chairman, to the administration. as we move forward into this plan, that will involve more focus groups, more meetings. In the interim of that, through you, Mr. Chairman, to the administration, may my office receive a copy of what the consultant has developed, this so-called matrix?
Through the chair, we can certainly get that for you.
Thank you, Mr. Chairman. Thank you, Mr. Chairman, thank you through you, Mr. Chairman, to the administration. And just final, more on that, when do you think we will receive a copy of that report/matrix made by the consultant? Will it be within a week, 2 weeks, 3 weeks, 4 weeks, a month?
Through the chair, I can have that for you by Monday.
Thank you so much. I look forward to it. Thank you, Mr. Chairman. Mr. Chairman, do I still have the floor, or should I just relax?
You
for a
can still
moment?
have the floor, Mr. Lefebvre.
Talk to me. Okay, thank you, Mr. Chairman. On page 169, the financial assistance, second bullet. Thank you so much for your finally installing the self-service kiosk. Oh. It's a softball question. Was it a difficult task to you, Mr. Chairman?
Through the chair, yes. Actually, they are not functional as yet. They are in each building, but the programming is not yet complete. We anticipate that in the next few weeks to have it done by the end of the year. So yes, it has been a very difficult process. Through the chair.
Thank you.
Legislator Barnhart.
Thank you. Just wanted to talk for a moment about the decline in caseloads, which was referenced during the presentation. We saw on page 171, safety net, family assistance, child welfare, that funding is decreasing by about 10%. And we see that the caseloads are also estimated to drop fairly dramatically. Poverty in our community hasn't dropped by 10%. Just want to dig into those numbers through the chair to the administration. Do we know what percentage of applications submitted were denied versus how many people were moved off of assistance because they didn't need it anymore? Like, how does that break down? Are we supposed to just trust that that these numbers are real?
Through the chair, a couple things. The numbers are real. They're actually reported through New York State Office of Temporary and Disability Assistance. We do track closely each month applications, which applications coming in are down year over year. So the number of people applying is down, trending down, has been trending down. I do want to say just one thing about poverty. People on public assistance are living below the poverty level, well below the poverty level. So while individuals in the community as a whole, you don't see a decrease in poverty, what you see represented in that is the explosion of the food stamp caseload, the SNAP caseload, because those people are considered the working poor, we have expanded eligibility, which takes a household up to 200% of the federal poverty level, while public assistance, the benefit rates are under 100% of the poverty level. So a person working only 20 hours at minimum wage would exceed the public assistance levels. So it's really hard to equate poverty levels in our community with actual public assistance. recipients just because of that difference in the way that eligibility rules are, which are set by the state and federal government. We do track how many people are being closed because they received employment. I'm sure you've heard the county executive talk repeatedly about the Pass to Empowerment program, and since that was initiated in April of 17, late 17, over 5,000 people have been referred to that program, and the only way you get referred to that program is because your case closed, because you received a job. You started a job that was more income than you were receiving on public assistance. So it is our focus. We close between 22 and 25% of cases each month due to that reason, and we do track that closely. We track recidivism on that. We track the reasons, other reasons why people get closed, or for a variety of reasons. There could be other reasons why a person gets closed and it doesn't get counted as what we call excess income, because maybe they got a job and didn't tell us, and so they fail in other ways by not showing up to appointments or not providing documentation. So the number could be even higher than that, but we do know that that people are getting jobs, because again, if you're employable and able to work, a minimum wage job is going to give you more income into your household than a public assistance grant. And then what we're left with are the hardest to serve people.
Thank you. Yeah, through the chair. Thank you so much for that explanation and the insight that you've provided. Do you have any idea what the percentage is of applications that you deny, and how many? What does that look like?
Well, through the chair, I did not bring that with me tonight. I apologize. I do have that information, and I will just preface it by saying, because again, this information is readily available through New York State OTDA, and I know that it has been a topic of conversation, denial rates in our community, but when you look at the denial rates, you have to look a little further, because the majority of our denials each month are for people who never appear for their eligibility appointment. And I think that I have expressed this before, that we are one of the only counties that allows an individual to apply before being seen, and being seen is a requirement of eligibility. So we have a fairly large number of applications that get denied because the person provided an application and then never returned. And so when you look at the raw denial data, it will appear that we have a large number of denials, but you have to dig a little deeper, and some of that information is not available to that level of specificity in the OTDA information. So we can provide that and provide the breakdown a little further about the no-shows, that's what we call when someone doesn't appear, as well as the number of people who apply and are ineligible because their income already exceeds the public assistance benefit levels. So they apply thinking they might be eligible, but they're not. We have a fair number of those. And then we also have a fair number of people who, once they come in and learn about the eligibility requirements, they decide that it's not something that they want to pursue, and and we do what we call a client request denial. So we are tracking all of that. We have been for as long as I've been in this position, over 5 years, and it's data that we're always looking at, and it is available so that we can provide it within the week through the chair.
Thank you so much. That does make sense. I'm curious as to, through the chair, why do you think applications are down so much? And I'm assuming that is also the explanation for why you have fewer fair hearings scheduled, estimated for 2020.
Through the chair, in a nutshell, the economy, the low unemployment rate. I mean, we don't get a lot of people that are fully employable applying for public assistance because they can get a job. And I will just note that it is a phenomenon across the state. Applications are down across the state for public assistance, and caseloads are down across the state. Other counties may not have as sharp a decline in public assistance caseload as we have, but it is something that is happening across the state. Through the chair.
Through the chair, emergency housing placements are estimated to decline by about 8% or 1,000. Can you talk about the reasons behind that estimate?
Mr. Chairman, can we get a quick page number?
I'm sorry, page 180.
Thank you.
Through the chair. In 2019, in 2018, actually, I'm sorry, 2017, the Governor Cuomo instituted some emergency regulations that has since become adopted around placements for individuals that would not otherwise be eligible for emergency housing placement related to their eligibility either for public assistance or due to sanction or due to income. And as a result of that, we placed more people in 2018 and in 2019 that would not have otherwise been eligible. In 2020, starting actually this Code Blue is what it's called season, which started a couple weeks ago, we anticipate handling those placements differently, and they will not show up as a regular placement counted in this manner. So we may still have the same number of placements, but they will not be. What we've done for the past 2 years is lump them in with the traditional placements. And in this Code Blue season, we would like to pull them out and record them and track them differently with some new partners and how we manage that. So it may not be that we have less placements, but we will not be, and if you have had the privilege to read the annual housing report, you will see this noted differently. It was different in last year's report, and in this year's report it will also be done differently, and also in the 2020 report to reflect the difference in that. And also to unduplicate the numbers, which has not been done in the past, through the chair.
I actually have a quick question to follow up on what was asked about referrals and applications being denied. And you mentioned a number of these denials happen because people don't show up to appointments. So my question is, how much time needs to pass after that denial before an applicant can reapply? Maybe they couldn't get a ride that day. How much time has to pass in order for them to apply after being denied?
Through you, no time. If a person needs to reschedule, if they call us before the appointment time, they will not need to reapply. We will reschedule the appointment. You can reuse an application up to 30 days after without having to fill out a new one, but by calling us and getting a new appointment date. After 30 days, you need to fill out a new application. But we have people that come later the same day and get a new appointment. So there is no waiting time for applying again if you miss your appointment.
Thank you.
Through you.
Thank you. Legislator Lamar.
Chair, to the administration, I just have a few questions about emergency housing. What are the requirements for emergency housing?
Through the chair, the first one is that you have to be homeless, and then emergency housing is a public assistance benefit, so you have to be otherwise eligible for public assistance. If you're under a current public assistance sanction, you're not eligible for emergency housing. If you have income that exceeds the public assistance benefit, you may be eligible for emergency housing, but you may have a partial, what we call partial pay or a payment share to receive emergency housing. Other than that, there are no other eligibility requirements. Some people may not be eligible because, as you're aware, the county doesn't actually own any shelters. We contract with shelters, and if a person is banned from those shelters, they may not be eligible for emergency housing, and we use alternative placements for individuals like that. Through the chair.
Thank you. Through the chair to the administration, does emergency housing service victims of violence?
Through the chair, domestic violence or just?
Violence.
If necessary, yes, through the chair.
Are you sure? Okay. Thank you. That's it.
Any other discussion on the budget? Legislator Lightfoot?
Thank you, Mr. Chairman. Mr. Chairman, on page 169, the Youth Bureau, under the first bullet, states somewhat, under the Youth Bureau, down at the bottom of the page, how many youth have been trained or found employment through the executive's County Youth to Work initiative, which is a new program? It wasn't in the 2019 proposal, so it's a new initiative, and so we're curious of this ad hoc program that came about. How successful is it?
Thank you. Through the chair, we think it's a pretty successful program already. It's never too late or too early to get youth to work, so we're glad to get this one off the ground this year. We have, with some great folks, first off, the Rochester Museum and Science Center. As you noted, it is a new program, so we don't have any numbers yet, so I'll stop you before you ask that question to the chair. But we're hoping to get 50 students into that program, and it's a great opportunity for them to learn STEM, not just activities, but research at the Museum and Science Center with their folks there as an after-school program. It is an initiative not only with them, but the Greater Rochester After School Alliance, and maybe some folks in this room are familiar with the great work that they do. So those are two awesome partners to have. Looking to get kids on the career path, not just to get jobs right now and maybe a few dollars in their pocket, but something to establish a career and keep going forward. We found that to be even more important. As you'd probably know, you've voted on in the budget this past year for folks at Villa of Hope, and they have kids that are in transition looking for employment for them and also looking onto a career path. So what we thought is we have all these great things that this legislature has voted for and this administration has signed off on. It's great to take a recollection, put them all together. You also voted for something called Go for the Gold through our friends at CCCS. I'm sure I don't need to remind you the great work that they do, and they are basically our financial gurus for these youth and their families who are participating in these programs. We look forward to partnering with them, not just this year, but having them throughout all of our initiatives. We find that having everyone in the community working with us and helping our youth, we've got some great partners to continue through the next few years while we are in these programs. Through the chair.
Through the chairman, thank you so much for your positive attitude. Through Mr. Chairman, to the administration, when did this particular program that we're talking about, the initiative that includes students going to the Museum Science Center and participating in STEM type projects and when did this initiative start?
So through the chair, that is something that we worked on getting the partnership together first. As I'm sure you know, it's a daunting task to get everyone to the table to begin with, and then to have agreement to get the funding. We were successful in getting that this year, and we hope to get that program started with the youth that we'll be funding either at the end of this year in December or probably January 2020, and whenever we get everything in motion.
Through you, Mr. Chairman, to the administration, how much was set aside for this particular program?
Mr. Chair, through the chair, I apologize, I didn't hear.
Through you, Mr. Chairman, to the administration, how much was set aside for this particular program?
So we worked with our Imagine Monroe folks, and it's roughly $65,000. I don't have that exact figure in
No
front of me,
worries.
but I believe it's that.
No worries. Thank you so much.
Thank you.
Through you, Mr. Chairman, to the administration, on page 169, Child and Family Services, the second bullet tells us, what are the actual numbers associated with the year, with the year-on-year decline? Child and Family Services, second bullet. Total CBS caseload size continues to decrease. Since 2018, the average caseload size has been reduced by 28% from June 28 to 2018 to 2019. So the question becomes, I think through you, Mr. Chairman, to the administration, has the CPS caseload size been reduced to the recommended levels?
Through the chair, we are currently at an average caseload of about 23, which is just above the recommended levels. We've decreased 21% in our open stages.
Thank you so much. Thank you so much. Thank you. Again, through you, Mr. Chairman, to the administration, my next question in particular is still on page 169. Child and Family Services, first bullet, furthering the 8-point plan for CPS. Aside from increasing the number of recruitment sessions and developing a website, what have we done? What have we done to further the 8-point plan for CPS improvement?
One of the major initiatives through the chair that we have going on currently is our TLC, or Change Leadership Team, to assist with recruitment and retention. This team has been meeting for the last couple months, and they'll be providing recommendations to leadership on what we can do to make their jobs more satisfying. Do we have the page in the budget that you referred?
So in addition to what we already listed is to improve sessions and development plans, we also have erected a TLC. I think that's standing for Tender and Loving Care, I guess.
I'm sorry.
Thank you, Mr. Chairman.
Back in the day, too.
Huh?
It's a good group back in the day.
I'm sorry, through the chair, could you repeat that?
So does TLC stand, through you, Mr. Chairman, Tender and Loving Care Leadership Team?
It's the Change Leadership Team,
Huh?
That changed.
TLC.
T-
It's a Change Leadership Team. Oh, I'm sorry, Lead the Change Team.
It's called Lead the Change?
Correct. And it's led by our Child and
Lead
Family. Lead the Change, and it's led by our
Change.
Child and Family Services
So it's a
directors.
LTC, not TLC. I must have misheard.
Sorry, my error.
LTC Leadership Team. And through you, Mr. Chairman, my colleague was talking to me. I'm gonna blame my colleague. So I missed, through you, Mr. Chairman, what the LTC Leadership Team is exactly what they're gonna do to further the 8-point plan.
Part of the 8-point plan was to develop a plan for recruitment and retention. This is led by CPS caseworkers. They'll be leading the change and giving us recommendations on what it would take to keep them with the organization.
Okay. I won't comment on that. Thank you so much. Through you, Mr. Chairman, another question that I have, and then I'll tag team to my colleague. Page 169, through you, Mr. Chairman. Does the county believe that the 8-point plan for CPS improvement has been totally fulfilled?
Through the chair, We, of course, continue to work on lowering the average caseload size per caseworker, but we've seen amazing results in a short period of time that's been recognized by OCFS as well.
And through you, Mr. Chairman, LCF stands for
I'm sorry, Office of Children and Family Services, our state oversight agency.
the State Oversight Agency. Through you, Mr. Chairman, finally, along this 8-point plan, the questioning, we don't see it listed as a 2020 major objective found on page 170. So are we dropping this plan, or what are we doing through you, Mr. Chairman?
Through the chair, there's parts of the plan that have come to fruition. There'll be no further work on it, such as the tablets, unless we get new caseworkers, who'll of course be assigned a new tablet. So some things you can't repeat. Most of it is an ongoing initiative. So it's ongoing reevaluation of how we're doing, and we may make adjustments along the way, but it's continued work as long as there's a Child Protective Services division.
Thank you, Mr. Chairman.
Legislator Lamar?
Thank you, Mr. Chairman. Through the chair to the administration, I just have one or two more questions about emergency housing.
Legislator Lamar, would you mind just
Sorry.
pointing the mic towards you? Thank you.
I just have one or two more questions about emergency housing. The young lady who answered the question mentioned domestic violence victims. Are there certain types of victims of violence that would be considered ineligible?
Through the chair, violence is not an eligibility factor. Again, the designation of homeless is the primary eligibility factor for emergency housing. So we separate out domestic violence because there is an actual domestic violence shelter that manages and has oversight for that type of placement. And we, while other people might be overflowed in other shelters if they're full, that is the designated, Willow is a designated domestic violence shelter. But there is no eligibility requirement around violence. When I sat down from the last question, Commissioner Crosdale reminded me that we just had someone yesterday who we placed in emergency housing last night because they were a victim of domestic violence as someone shot at their house. And so we regularly place people as victims of violence if the violence has rendered them homeless or where they're currently living presents a danger to them. And that happens regularly, unfortunately, through the chair.
Thank you. I just have just one last comment, and probably in reference to the same person that you just mentioned, who had a shootout at her house, who was deemed ineligible for emergency housing. She wasn't placed last night. I just wanted to put that on the record. I just wanted to mention that she wasn't placed last night because emergency housing deems her a safety risk because of the type of violence that happened. So so I guess my follow-up to that, is that based on a hunch, or is that based on data, or?
Through the chair, that would be based on the shelter, because as I indicated previously, we don't own shelters, and we cannot force a shelter to take someone if they do an assessment, but we can talk offline about that,
Okay.
because again, the commissioner was involved in that last night. We both were,
Me too.
and we could talk about that offline. But
Okay.
that could be a shelter decision based on what they deem as safety to the other people that they have in their shelter.
Okay,
Yeah.
thank you very much.
Through the chair. Yeah.
Legislator Wilt?
Yes, through the chair. You mentioned sanctions. Can you give me a list of reasons why people are sanctioned when they're homeless?
Through the chair, public assistance sanctions would happen prior to being homeless, so that would make them, so it would be an existing sanction for some other failure, and then when the person presented as homeless, they would be ineligible for shelter placement unless we were under the Code Blue regulations, because they would be ineligible for public assistance.
Okay, through the chair, though, I'm trying to understand here, why are sanctions put on people when applying?
Through the chair, sanctions are applied to, they're public assistance sanctions that are imposed for public assistance recipients who have a failure of an eligibility requirement. There are 3 types of sanctions, all public assistance sanctions. One would be a failure to comply with employment requirements that are mandated by state and federal government. A second type of sanction would be a substance use sanction for individual that is mandated to treatment as a condition of eligibility for public assistance and they fail to comply with that. And then the third type of sanction is child support sanction, complying with child support if there is a child in the household that has a parent outside of the household is a requirement according to state and federal statute. And when a person fails to comply with child support, they could be sanctioned. And what a sanction actually entails is the pro rata removal of that person's needs from the case. So if it's one person and their needs are removed, the entire case is closed. But then if it's a 2-person household, then 50% of the grant is removed for that one person's needs. If it's a 3-person, it's a third. If it's 4, it's a fourth. So that's the pro rata way a sanction works. So children are never sanctioned. Sanctions apply only to the adults over 18 in the household that are required to comply with public assistance eligibility requirements.
Thank you.
Through the chair.
Thank you. Any other discussion on this? Just want to thank the administration for the responses. Very thoughtful, very thorough. Appreciate you guys very much. Thank you for the lively discussion as well. The next item on the agenda is approval of the minutes. You have the October 22nd, 2019 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is our new business. Mr. Clerk.
Referral 19-0291.
Moved by Legislator Taylor, seconded by Legislator Halsted. Is there any discussion on this item? Seeing none. Do we need to go to a roll call vote? I'm going to call for a roll call vote, please.
Ms. Barnhart? Yes. Mrs. Draw? Yes. Mrs. Halsted? Yes. Ms. Lamar? Yes. Mr. Lightfoot? Mr. Mitchell is excused. Ms. Taylor? Yes. Mr. Wilt? Yes. Chairman Zale?
Yes. We able to leave that open?
Yep, we can leave it.
Thank you. Next item, please.
Referral 19-0292.
Moved by Legislator Halsted, seconded by Legislator Draw. Is there any discussion on this item? Legislator Lamar.
Through the chair to the administration, what is the current backlog?
Through the chair, would you please repeat the question?
What is the current backlog?
Through the chair, what is the current backlog of what?
So the partial grant will fund travel and staff training for certifications as well as reduce the case backlog. So I'm assuming there's a backlog.
Through the chair, Bob Zerby from the Medical Examiner's Office. The current backlog is, it's roughly, I'm going to say 200 cases. Now, backlog, just let me, for clarification purposes, is difficult in our world. Generally, what happens is we have a case referred to us, and we deal with it with the resources that we have available to us. The purpose of this particular grant is to up those those resources. If I may for a moment, the events essentially of the opioid crisis were disastrous to our community. We're all aware of that. A disaster being something where the community doesn't necessarily have the resources at hand. What we did, but with a slight difference, generally a disaster has an endpoint. If a plane crashes, for example, it's over. You're not going to find more people. This is insidious. It's continuing. So what we've done is recognize we need staffing. We need forensic pathologists. There's none out there. It's a very difficult role to fill. It's not necessarily a viable career. When one looks at the pay options for a forensic pathologist, and this body, as well as the administration, has been very forthwith in recognizing that. So we have staffing. We have an expansion program going on in our building to get it up to par to deal with this bigger load. But the staffing needs training, and that's a portion of what this is for. As well, a part of this is to increase the monies available to support contract physicians who we can identify and bring in to actually help our pathologists. When a case comes in, there's the examination portion, and then you have to review the material that comes afterwards, the toxicology results, for example. And as those results are coming in, there's still cases coming in behind it. So you're never, it's kind of this ongoing thing, and you never really get ahead. By having these additional physicians, they can kind of take the load off, so our doctors can circle back and do, I guess, what you call the backroom work, reviewing the things and pulling that forward. So that's essentially where we're moving with this. It's a 2-year agreement, so we can continue this, keep people up to snuff, make sure they're as familiar as they can be with what the upcoming technologies are, as well as having the supportive methods that we need to get the job done. Again, through the chair.
Through the chair, thank you for that thorough explanation.
Any other discussion on this item? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item, please.
Referral 19-0293.
Moved by legislator Draw, seconded by legislator Wilt. Is there any discussion on this item? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item, please.
Referral 19-0294.
Moved by legislator Wilt, seconded by legislator Taylor. Is there any discussion on this item? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item, please.
Referral 19-0295.
Moved by legislator Taylor, seconded by legislator Halsted. Is there any discussion on this item? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item, please.
Referral 19-0296.
Moved by legislator Halsted, seconded by legislator Draw. Is there any discussion on this item? Legislator Will.
Through the chair, why was there a $233,000 decrease in funding, and will there be a reduction in any services as a result?
Through the chair, Meredith Smith, Department of Human Services. That amount of money is set for a contract for services for which procurement has not yet been complete. Once procurement is complete and a vendor is selected, we will be back before the legislature to seek authorization to contract for those services.
Okay, through the chair, so there is no reduction in services, right? Is that correct?
That's, through the chair, that's correct.
Thank you.
Any other discussion on this item? Seeing none, all those in favor signify by saying aye.
Aye.
Any opposed? Item carries. Next item, please.
Referral 19-0297.
Legislator Draw, seconded by legislator Wilt. Is there any discussion on this item? Legislator Lightfoot.
Thank you, Mr. Chairman. Mr. Chairman, in short, through you to the administration, may the Human Service Committee members be provided with a copy of the Child and Family Services Plan?
Yes, Mr. Chairman.
Through you, Mr. Chairman, to the administration, this is, second plan of a request, I guess, for something else. When do we think we will receive it? In 1 week, 2 weeks, 3 weeks, 4 weeks? Through you, Mr. Chairman?
Mr. Chairman, I'm sure that will be provided before the next legislative meeting in December. I will throw out, it is available from if I can speak clearly, it is available for download from the New York State OCFS website.
Yeah, I'm not savvy at that. I'll wait for the thing to come before the next legislative meeting. Thank you so much.
Any other discussion on this item? All those in favor signify by saying aye. Any opposed? Item carries. Next item, please.
Referral 19-0298.
Moved by legislator Wilt, seconded by legislator Taylor. Any discussion on this item? Seeing none. All those in favor signify by saying aye. Any opposed? Item carries. Next item, please.
Referral 19-0299.
Moved by legislator Taylor, seconded by legislator Halsted. Any discussion on this item? Seeing none. All those in favor signify by saying aye. Any opposed? Item carries. Next item, please.
Referral 19-0307.
Moved by legislator Halsted, seconded by legislator Draw. Any discussion? Legislator Lightfoot.
Thank you, Mr. Chairman. Just a quick question. Who else applied for this RFP?
Through the chair, Colleen Rose from MCH. We had preventative diagnostics, Rochester Mobile X-ray, and ultramobile imaging.
Through you, Mr. Chairman, has Ultramobile provided this service in the past?
Through the chair, yes.
Thank you.
Any other discussion on this item? Seeing none. All those in favor signify by saying aye. Any opposed? Item carries. Next item, please.
Referral 19-0310.
Moved by legislator Draw, seconded by legislator Wilt. Any discussion? All those in favor signify by saying aye. Any opposed? Item carries. Oh, yes. Legislator Lightfoot, would you like to record your vote on referral number 19-0291?
Yes.
In the affirmative? Okay, thank you. Are there any other matters to come before this committee? There being no other matters, the November 26, 2019 meeting of the Human Services Committee stands adjourned. Next meeting of the Human Services Committee will be announced. Happy Thanksgiving.